for the town of Plymouth. I'm Steve Triffletti. This is our 97th presentation as we count down to number 100 later this month. And I'm your Plymouth Town Moderator. We're here each Wednesday for the month of May at noon for this update. And this forum is being brought to you live by PAC TV on Comcast Channel 15, Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Philip Triffletti, Dr. Barry Potvin, also Michelle Bratti, and Amy Naples. And at this time, we're going to begin and welcome Kenneth Tavares. He is chair of the select board for the town of Plymouth. Welcome, Ken. And Ken, you unmute yourself, if you will. Thank you. Ken
okay. Thank you. Good afternoon, everyone. Before we start, it is not just screen. I do have a black eye. I slipped and met some pavement, good Plymouth pavement last week, but all is well. I want to repeat something that I did last week because Pearl C, as our town clerk, is concerned that the information regarding the election on Saturday, May 15th needs to be stepped up. She wants to remind everyone that the polling locations are going to be open from 7 a.m. to 7 p.m. and that if you're interested in working at the polls, there are openings and you can call the clerk's office at 508-747-1620, extension 10218, and they'd be happy to talk to you. Also, Pearl said that the election laws allowing voting by mail have been extended. Any voter that would like to vote by mail should complete the application available on the town clerk's webpage. Applications can be submitted by mail, email, ballot box, or fax. And the deadline for a ballot by mail is May 11th at 5 p.m. So you still have some time. Voters will be able to track their ballot status at trackmyballotma.com. One thing that we all need to remember when we go in is that this year's ballot will be two-sided with the charter question, and the candidates' names for charter commission will be on the back. Ballots must be returned to the ballot box at the main entrance to town hall by mail or in person. Ballots must be received in the town clerk's office by 7 p.m. on election day. In-person absentee voting is available until noon on Friday, May 14th. Again, this information is from our town clerk. Thank you.
And that's Kenneth Tavares. He is chair of the select board for the town of Plymouth. He's here with our panel to answer your questions. Send them to plymouthinfo@pactv.org. And now we begin our medical segment as we do each week. And joining us once again, Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Welcome, Brother Phil.
Thank you, Stephen. Thanks for having me again. Good afternoon. I'm going to start today by just addressing questions that I get in my medical practice. I think that's often a great place to start. And so one that I got yesterday was somebody was wondering about traveling. They have a house in Denver, Colorado, and they spend time there. And so I went back and I looked at the CDC recommendations. So as of April 27th, about a little over a week ago, the CDC did say that, yes, it's safe to travel if you're, fully vaccinated. And of course, when you're traveling in the airlines and the airports, you would still wear a mask and socially distance and use hand sanitizer. But I think that the CDC has been very conservative about, bringing forth, changes. And I think it's great when they say they feel it's safe to travel and they're no longer restricting people to essential travel, which is what the guidelines were prior to that. I think it just goes to show you how far we've come with managing the pandemic and how much success we've had with our vaccination program, and of course, how effective vaccines are for protecting you. So, but yes, I think it's safe to travel within the United States. on airlines. That's a great news. Another question that came up, this one's more difficult, not an easy one. Really, people wondering, should they be eating indoors in a restaurant if they're fully vaccinated? And the answer from that is not as easy or clear cut. I think that, as I said, the CDC has been very conservative about the recommendations. And so I think that they still, look at indoor activities without masks as presenting some risk, even if you have been fully vaccinated. And I think 2 weeks ago, I went over some of the data from the CDC and what we call breakthrough infections, which can occur, but they're relatively infrequent. And the great news there for people who have been fully vaccinated and get infected with COVID, because it can happen, the risk of hospitalization is low. The risk of death from infection would be, very, very low. So, I think that there's probably very little risk eating indoors. However, myself personally, if I had a choice between eating indoors and outdoors, if the weather was good, we're coming into the good part of the weather season for outdoor dining here in New England, I would choose to still eat outdoors as opposed to indoors. I think that's still your safest bet, even though I'm fully vaccinated. So, that's a tough one. I think eventually, you'll get more guidance about that safety. I know other experts in infectious disease, when they speak in the media, they're still reluctant to eat indoors. So I think that tells you a little bit about, where we are right now. The next news item that came up in the last few days, I thought would be important just to point out, the Pfizer vaccine has been approved for ages, including age 16 and up, but we're expecting from the FDA within the next week to have an emergency use authorization for use in children ages 12 to 15. So that's very exciting. I think in the coming, summer months and for the school season next fall, we're going to be able to have our junior high school and high school age children vaccinated. I think that's great for our public health and for the health in our communities. So very, very exciting. As you probably know, a lot of the companies are still researching the vaccine for the age 6 months of age up until this age 12 group. So, by early next winter, we're hoping it will be able to show safety and effectiveness of the vaccine in, the younger age groups of children, and that we can continue to work on getting the whole community vaccinated and immunized. So we continue to see great progress there. Another news item that has been floating in the media in recent days is, some experts talking about herd immunity. And I think when you listen to them talk about herd immunity and them thinking that it will be difficult to achieve in the United States and elsewhere, it sounds a little discouraging, I think, when you listen to it. But, the truth is, we're doing very, very well with the pandemic here in the United States, certainly in Massachusetts, we're doing very well. I think the way you should think of when they say that herd immunity may be difficult to attain, you should really be thinking about eradicating or eliminating the virus 100%, getting rid of it. Well, that may not be possible, or may be very, very challenging to do, depending on, how many people we get to accept vaccination. And, if you're following the statistics, you can see, there's probably, 20% of the US population is hesitant, meaning that they're thinking about it and they might be convinced. And then you have probably 20% of the population that's resistant, that are, more firmly opposed to taking the vaccine. So I think looking at those numbers, I think that's part of why the experts are weighing in on how difficult it would be to get to herd immunity with such high numbers of people, hesitant and resistant. But, we're doing extremely well here in Massachusetts and in the United States in general. Obviously, if you compare to some other countries around the globe that are really struggling. I mean, we're seeing a continued decline in infections per day. We got below 100 infections reported yesterday in the state of Massachusetts. Got less than 1,000, down to 700, which is a new milestone for us in this recent surge. So we're seeing declining infections per day, declining hospitalizations per day, declining deaths. I mean, all these things are improving. So we're making great progress. I thought it's very interesting to look at other countries where they've done well with vaccination. So two examples are Israel and the United Kingdom. In Israel, they've actually gotten about 60% of their population to have at least one vaccine. In the UK, they have about 52% of their population has gotten at least one vaccine. Here in the United States, it's about 44%. And so it's believed that Israel and the UK are probably, maybe 4 to 8 weeks ahead of us in terms of their vaccine programs. And if you look at the number of cases of infection that they're getting per day in those countries, in Israel and UK, I mean, the numbers are way, way down. Of course, both countries are much smaller than us, but Israel's having less than 100 cases per day of new infections. I mean, that's unbelievable. Their country is slightly larger than Massachusetts, about 9+ million people. So their infection rates now are very low, much of which is attributed really to the vaccination program. In the UK right now, they're seeing about 2,000 infections per day. They're a much bigger country. They're more in the 65 million population range. So, you can try to extrapolate that to here in the United States, where unfortunately we're still running at about 50,000 infections per day. But, you can anticipate as, we go from month to month, more people get vaccinated. Once we get to the 50% mark or the 60% mark, we're going to also probably see declining rates. So I think things look very favorable. I do want to say, I'm very excited about Joe Biden's, new goal to have 70% of our population getting at least one vaccine by July 4th. So for that, I say, go Joe. I think it's very, very exciting that, he's providing leadership from the bully pulpit, and encouraging people to get vaccinated. The last thing I wanted to mention just briefly is, watching the controversy, what I consider controversy unfold about, what to do about making vaccines mandatory. Obviously a lot of universities locally in New England here are requiring it for the fall. I don't see a big outcry about it. Some employers nationally in hospitals, although none locally that I'm aware of, are starting to require vaccinations. I'm hoping that there'll be more mandates. I'm surprised right now the White House leadership, they're not in favor of mandatory vaccination, and they're trying to think of other creative ways to get people vaccinated. I do think, examples I can remember at my own hospital when we started to require vaccinations for influenza. We used to only have a 70% vaccination rate of our employees at the hospital. Once we had a mandatory requirement where they would actually terminate you from employment, even if you're a doctor, if you didn't get your vaccine, then our rates went up to 90%, well over 90% from 70%. So I think that there will be lots of opportunities for mandates. I hope a lot of employers and other institutions will be considering. I think it is a good way to try to help move things along. So that's what I have to open. And as always, happy to take questions and contribute at the end. Thank you very much for having me today.
Thank you, Dr. Philip Triffletti. He is an attending primary care physician, Beth Israel Deaconess. At this point, we're going to continue our medical segment. We're going to go right to Dr. Barry Potvin. He is the chair of the Board of Health for the town of Plymouth. Welcome, Barry.
Thank you, Steve. I'm doing an extra update show because Karen Keene couldn't be here today. I'm happy to do it as much as I can. So thank you for having me again. I wanted to start off by mentioning a little bit of information about what's going on in India. You may know that they're having a terrible time over there with surges and running out of oxygen supplies, and the death rates are astonishing. a lot of it is being caused by, loosening up the restrictions too soon and a lot of complacency. But they're suffering horribly, and the United States is starting to send all kinds of supplies, as other countries are. The problem for us with this also is that as more people get infected and the virus replicates more, it's much more likely that some very troubling variants will arise that could easily spread. That being said, I wanted to, as I usually try to do, let me try to get this back so I can screen share it with you. And go to slideshow. So a lot of this is going to be very positive sort of things. I'm kind of always worried about all kinds of stuff, but all of this is putting a grin on my face, which doesn't happen terribly often when I'm dealing with this kind of stuff. But if you look down on the bottom, this came from last Thursday's data. Plymouth finally got themselves back to yellow moderate risk category because the positive test rate was below 4. We expect, based on what we've seen coming in from the Plymouth data that Karen puts out along with our new public health nurse on a daily basis, that this is going to continue. The trend should stay the same, and numbers are probably going to continue to decrease. This just shows you what happened in Plymouth over a long period of time. And you can see from this graph that the numbers have continued to slide down. And so we were down at 18.1. I'm anticipating as of tomorrow night, this number will get even lower. If you look at Massachusetts statewide, you notice that the number of red communities have shrunk considerably down to 26, and Plymouth is not one of them anymore. This is what's been going on as of yesterday's data with cases and deaths in the United States, Massachusetts, and Plymouth. Important thing here is that although these numbers have tended to go up very slowly now, they are still going up, except for the number of deaths in Plymouth, which has stayed flat at 150 for probably close to a month and a half or 2 months. So we're just not seeing any more deaths. We're still getting some cases coming up occasionally. If you look now at what's going on with our vaccinations, and again, whoops. Should go back. Having a lot of trouble doing this all of a sudden. Let me try it again. We'll get on to this one. So if you look at the vaccinations, I think I hit something incorrectly. That's why that happened. This is what's going on as of last Thursday. And you can quickly see that 53% of our population has received at least 1 or more doses. 36% were fully vaccinated. And if you look at the older age groups, you can see we're way up in the 90s for people that have gotten at least 1 or more vaccines. And the numbers are going up generally for the younger groups also. So that's a very positive sort of development. This is the big news that just arrived, I guess, about a half an hour now. There was some negotiations going on with the leadership at Beth Israel Leahy in Plymouth about what to do about the Colony Place vaccination site, where they started to see decreasing demand for appointments. And after some negotiations with the hospital leadership, they decided that they would actually do what you see here. So they're going to welcome anyone 18 and older to their walk-in community vaccination clinics. No appointment needed. You don't have to call ahead. The walk-in hours are listed here. There's no insurance information needed, but if you have it, please bring it with you. They do need a valid ID. They'll be giving Moderna, which means, as Dr. Phil knows, that they can't do it for the younger groups, so it's only for people 18 and older at the moment. They're hoping they're going to get Pfizer soon also. And if they do, they can drop that down probably within a week to the age of 12 and above. After the first vaccine shot, they'll contact you to schedule your second shot. There are interpreter services available at all these sites, including the one in Plymouth. All sites are fully accessible. They're targeting the start date for this of the week of May 10th to 14th. running the vaccinations from 9 to 11 in the morning and 1 to 3 in the afternoon. It's over near where the Pier Imports building used to be. The store is closed now, but Beth Israel Deaconess took it over for this purpose. There's plenty of parking. On arrival, you go in through the front door, check in, wait to be directed to the vaccination site table, and if necessary, a line will be forming outside. So please plan accordingly in case you have to wait. Continue maintaining a social distance of at least 6 feet. It's fully accessible. There are restrooms available and wheelchairs are available. So basically, it's all good. We're hoping that this is going to encourage a lot of the people in Plymouth and the surrounding towns that haven't yet gotten vaccines to get it. It's going to be very conveniently located now. I'd like to see Plymouth, in spite of the fact that we had to struggle through not having much in the way of vaccination sites nearby us for a long time, I'd like to see Plymouth take the lead in the state and show the state that in spite of all the difficulties, we are going to have probably the highest vaccination rate of any community in the state, I hope. So let's all get at it and try to accomplish that as quickly as you can. It'll help the town, it'll help the businesses, and there's basically no downsides to this. It'll be publicized on O'Connor Memorial, on Wicked Local, probably a lot of Facebook pages. The schools are being notified to notify all the parents and staff and students about this availability. And I'd like to see this place get flooded with people that want vaccines that haven't yet gotten them, for the best purposes of all concerned. I guess we can go through Michelle Bratti and also, of course, Amy Naples with the Chamber of Commerce to get even more publicity out as much as we can. Sorry about the phone ringing. I just unplugged it to stop that. So please keep that in mind. I wanted to go through quickly what's happening on May 10th. We did this last time, but large venues such as indoor and outdoor stadiums, arenas, and ballparks currently open as part of phase 4, step 1 at 12% are going to go up to 25% capacity. So that's Fenway Park, the Garden, and other large settings. There's going to be some other things opening in outdoor settings, including amusement parks, theme parks, outdoor water parks, can operate up 50% capacity, but they must first submit safety plans to our Department of Public Health for our review. Road races and other large outdoor organized amateur professional group athletic events be permitted to take place with staggered starts after submitting safety plans to the local Board of Health or the Department of Public Health. Youth and adult amateur sports tournaments allowed for moderate and high-risk sports. Singing will be permitted indoors with strict social distancing requirements at performance venues, restaurants, event venues, and other businesses. And a short time after that, you will find, let me see if I got to go back to the slideshow again. I lost it again. I'm having all kinds of troubles today. Try it once more. So if I go now to the slideshow, I hope. It won't do it. I guess I'll have to do it the other way. Sorry about the difficulties. So if you go to the next slide, you would find things that are happening on the 29th. And that's going to include some more things that are going to be opening up. Can everyone still see this, I hope? Okay. So subject to public health and vaccination data, the limits may go up to 200 people indoors and 250 outdoors. That's for event venues, public settings, and private settings. There'll be more industries opening. Street festivals, parades, and agricultural festivals will be allowed at 50% of previous capacity after they submit safety plans to local Board of Health. Bars, beer gardens, breweries, wineries, distilleries will be subject to opening also, but with restaurant rules, with seated service only, no standing up service, only for also 90-minute time limits and no dance floors allowed. And also you notice restaurant guidance will be updated to eliminate food being served with alcohol. So you can order alcoholic beverages without food starting then. and there'll be an increase in maximum table size to 10. Eventually, things will change more. That'll be happening on August 1st. There's going to be other things happening according to the latest Department of Public Health webinar. There may be more changes coming out for the 10th and the 29th of May. This question came up last time. At the workplaces, everyone must wear masks unless they're in individual workspaces or completely alone. So even if 9 people out of 10 are fully vaccinated, you must still all wear masks unless you're in an individual workspace or completely alone. Outdoor public and semi-public spas and hot tubs are not allowed to be open until August 1st. Outdoor public and semi-public swimming pools, currently masks are required unless you're eating, drinking, or actively swimming. Also, currently physical distancing is required between groups and individuals. This would apply to beaches as well. But we were told some of this may change on the 10th of May. Charter boat operations, since we have some here in Plymouth, maximum capacity is set at 50 persons on these charter boat operations. I know there's one that runs from Plymouth out to Provincetown. That may change effective on May 29th. So that's all I have at the moment. And I'll be happy to answer as many questions as come up at the end of the show. Thank you, Steve.
Thank you. And Dr. Barry Potvin is a professor emeritus, Yeshiva University Department of Biology. He is an epidemiologist. And at this time, we welcome back Michelle Bratti. She is Director of Elder Affairs for the town of Plymouth. And Michelle, for the past year, you've been talking to us about seniors in Plymouth. What do you have for us today?
Thanks, Steve, and PAC TV as always for having me as a guest. I can't believe the number of shows. Hello to my fellow wonderful panelists. I would like to extend a very special thank you to 2 class act gentlemen, Ken Tavares and Matt Muratore, who both came to Cal to wish our 22-year town employee well wishes on her retirement. And Matt even presented her with a special citation from the state. Thank you both for always supporting Cal. Although today is not cooperating, the weather is changing for the better, and along with it, so is our outlook for a hopeful future at Cal. We can feel summer in the air, and we're excited about seeing patrons in person again. We are happy to announce our limited reopening on Monday, May 10th. During this week, we will begin a hybrid of indoor and outdoor programming, and we will incorporate those that still wish to participate in activities via Zoom in many of our live classes. There truly is something for everyone's comfort level. We're starting small, but the important thing is we're starting. And as trite as it may sound, one of the best announcements since March 2020 is that we will be welcoming our patrons back through the Cal front doors. Even when we opened briefly last summer, we could only utilize the side door to our facility for entering and exiting the building. We feel walking through the front doors of Cal is symbolic with coming home. And there is no greater feeling than this for myself and the Cal staff. Along with our patrons, we are also welcoming back some very beloved volunteers to assist with the screening and registration process. We held a refresher orientation for these folks since so much has changed in the last year and a half, and we will continue to offer these refreshers as we welcome back other volunteers to Cal. We do need volunteers for specific roles, such as Meals on Wheels, help in the kitchen, and grab and go assistance. If you are interested in volunteering at Cal, please call Ginny Healy. I think you know our number, but 508-830-4230, and she's at extension 103. While in a perfect world, we would want to throw the doors open and welcome everyone back at once, please understand that we are moving slowly and systematically. COVID is still very much part of our world, and we must remain cautious and continue to adhere to the mandates and guidelines set forth by our state and town. In the beginning stages of our reopening, Cal will only be open for scheduled programming, and patrons must be registered for these programs as there are no walk-ins allowed. We certainly hope to move towards a more socially friendly and less restrictive environment as we progress towards the governor's goals for reopening the state, but we're not there yet. We're getting there. Vaccination does not mean no masks at Cal. I think that's going to be one of the biggest messages. In the meantime, we have some fabulous in-person programming beginning next week, including mindful movement, yoga, mindfulness, watercolors with Cindy. Yes, in the actual art room, and sit and get fit. Register online at My Active Center or call Cynthia at 508-830-4230 for registration assistance. We truly can't wait to see you in person. We're happy to report, and it's been reported, and Dr. Potvin shared some of this, but from a senior perspective, so happy to report that in Plymouth, of those residents who are 75 years plus, 79% are fully vaccinated and 93% have had at least one dose. And those 65 to 74 years old, 75% are fully vaccinated and 91% have at least one dose. I'm sure Matt will review the stats in further detail, but we are so pleased and proud of our Plymouth seniors and their commitment to their health and well-being and the well-being of those around them. Thank you, Steve.
For the town of Plymouth, and she'll be here to answer your questions. Please send them to plymouthinfo@pactv.org. And at this time, we return, as we often do, to our business segment, and we welcome back Amy Naples. She is the Executive Director for the Plymouth Area Chamber of Commerce. And Amy, I know you have a big event coming up this weekend.
Yes, we have lots of big events happening. Hello, Steve, and hello to my fellow panelists. As always, it is such a pleasure to be on this update and gathering this amazing feedback by all of the panelists. And these shows have certainly been such an important marketing tool for the chamber, and I'm so appreciative. And I think Michelle said it best. We have some really top-notch people: Ken, Matt, Barry, Dr. Phil. I mean, the information we receive is just tremendous. So thank you to you, Steve, and PAC TV. But yes, we do have lots happening, a very large event this weekend. And as always, we remain very busy. First, I wanted to highlight a couple of opportunities for our viewers to support our small businesses. If you don't know, now you'll know. It is Small Business Week, and we are celebrating in true chamber fashion, being the cheerleader for our business community. So we're asking all of you to, of course, show some love and support our local businesses and the amazing champions among our community. So we've come up some great ideas of how you can do that. So today, in addition to Cinco de Mayo, it is Wacky Wednesday, and we say that before the margaritas. Wacky Wednesday is our way to suggest that you visit a business you've never been to before. Just something out of the norm, something kind of wacky. Push you out of your box or comfort zone. Go in, introduce yourself. Most of the people behind the counters are small business owners. Check out their location, see what they have to offer, and see maybe how you can help them. It's a great way to support a small business. I'm not saying you have to purchase something, but you can check things out for further. For future purchases, however that may be. We know it's critical to continue to support our local businesses and aid with our recovery efforts, and it certainly starts here locally. So we are celebrating them because we think they certainly deserve to be celebrated for all they have overcome this year. And of course, because our restaurants, retailers, art studios, cultural assets, and service businesses are what enhance the personalities of our town. They understand our community, shape them to be the amazing place that we call home. So we love celebrating them. We love shouting on the rooftops, asking people to support them. So the lineup for the week is, as I said, today is Wacky Wednesday. Thursday is Thankful Thursday. So we ask you to reach out to a small business and thank them for their contributions to the community. We have so many to choose from, so it's so simple to to select one. Take time out of your day to write a review, a positive review about a local business. That's a great way to celebrate as well. Friday is Friendly Friday. Grab a friend, shop, dine, play in our community. Good way to push yourself outside and enjoy some fresh air. Saturday, as Steve mentioned, is a big day. So we have a great opportunity for you to support small businesses by participating in the Fitness for the Fund, which is going to be held from 7 a.m. to 12 p.m. at Plymouth Fitness. We have some amazing fitness classes lined up, thanks to Plymouth Fitness for providing the instructors, obviously the facility, and putting this event together for us. 100% of those proceeds are going to our small businesses because of the Plymouth One Fund. And we do know there is still great demand because we do receive applications every day for financial assistance. So we are working on building that fund. And the Saturday is a great way to kind of get your sweat on, get ready for the summer season, and kickstart maybe your fitness goals. And then Sunday, spoil mom. Mom certainly deserves a special day, and we have some ideas to make it great. As always, the Chamber has put together a Mother's Day gift guide highlighting our local businesses with some unique gifts we know that mom will love. So check that out. In addition, we have a Mother's Day dining guide, which is a guide compiling all of the local restaurant menus. So it's easy to kind of scroll through and check out who has what and decide where to take mom, because again, she deserves it. And our local restaurants have some delicious meals. We know that she wouldn't be disappointed with you taking her there. So those are two great opportunities to spoil mom on Mother's Day. And you can find all of that at plymouthchamber.com. Follow us on Facebook, or certainly reach out to me, or you can go to our website to be added to our newsletter. And then that way you receive all the guides at any time we send them out. And then a couple more items I just want to report on, specific for our business community who may be tuning in. Tomorrow we are hosting Net Walking. It was supposed to be today, actually at noon, but we had a little rain delay. So tomorrow at 12 o'clock, we will be meeting at Sandy's on Plymouth Long Beach to net walk. That's right, networking and walking. It's a great opportunity to get some fresh air. All are welcome to come. Just meet us at Sandy's at noon and we'll walk and talk. On May 20th, we'll be hosting our first in-person power lunch at Anna's Harborside, located on the waterfront. It will be outdoors. So for anybody who is uncomfortable with dining indoors, we will be networking over lunch, and it's a great facilitated networking event. Pre-registration is required, so certainly visit plymouthchamber.com for that. And then on Friday morning at 8:30 a.m., which Friday, May 7th, via Zoom, the Chamber, along with our partners at C Plymouth, Plymouth Economic Development Foundation, and the Plymouth Bay Cultural District are holding an information session on the Commonwealth's My Local campaign. And presenting will be Mass Office of Travel and Tourism Director Keiko Oral. So anyone interested in learning about this great marketing campaign to support our local businesses is welcome to join. For businesses, if you'd like to learn how you can take advantage of this great marketing campaign, please join us. It's a great opportunity to learn how you can put this in place for your business. And then we have a restaurant revitalization fund. That's a mouthful to say, session hosted by the SBA on May 13th from 1 to 2:30. This session will go into specific guidelines, application process, best practices, and obviously encouraging restaurants to participate so they can be sure that they take advantage of that great opportunity. And lastly, we know businesses are continuing to be challenged by finding employment. That is personally what we're working on all the time with businesses. We think it's going to be one of the largest hurdles we overcome in recovery efforts. So we are working to aid our small businesses locally with that, and working with Mass Hire and having a virtual job fair on May 19th from 10 a.m. to 1 p.m. So it is free for both the employers and job seekers. So interested employers, just reach out to myself or Ashley Taro from Mass Hire to register. And then job seekers, save the date, put that on your calendar and join us. It is, again, virtual. It's a really great platform where you can chat with the employers, learn more about the positions available. As always, if you have any questions in regards to that, feel free to reach out to the chamber at 508-830-1620 and stay up to date on all of our happenings by following us on Facebook and Instagram. So thank you, Steve, as always, for the opportunity to provide today's business update.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Now we're going to go, as we do each week, for our State of the State report from Plymouth State Representative Matthew Muratore. And Matt, Amy and Michelle both expressed our gratitude for PAC TV. And as you know, they have been supporting us throughout the year. I know you brought back your show that you have on PAC TV. But today, just to give viewers an idea, we have Max as the director. We have Tom is our Zoom operator. And we also have graphics being done by Melissa. Donna is our floor director. Brooke is our engineer. Nate is a director in training. And Julie is the executive director here at PAC TV. So lots of people pulling together to make this presentation happen. And Matt, what do you have for us?
Yeah, I'm glad you pointed that out, Steve. It's a great team there. And as you know, I'm a member of the board of directors of PAC TV. And I just witness all the time, how they work together for the community. And this is just one good example of, look how many people it takes to do this show. But it's so important to be doing this show and getting the information out to the folks that really need it. So gratitude again to PAC TV. As both physicians noted that the COVID cases have been dropping. So we currently have 22,248 active cases here in the Commonwealth. And I think by the time, Steve, we finish our shows on May 26th, we'll probably be down to a few thousand that will be currently active at that point. The total confirmed cases since we started the pandemic is a little under 10%, 9.3% of the Commonwealth actually got the coronavirus. 17,293 deaths total at this point. The 7-day average has been still running about 1.6. So that's good. Hospitals are down to almost 500 in the Commonwealth at this point. So that keeps dropping. And the ICU patients are 136 and the ventilators are below 100 at 85. So all the numbers are going in the right direction. With regard to the vaccine, we have received 7.3 million vaccines in the Commonwealth since we started receiving them. 6.3 million doses have been administered. That's a little over 85% of what we received has been administered. The breakdown is 3.6 million first doses, 2.4 million second doses, and in addition, 2 million of the J&J doses as well. So 2.6 million have been fully vaccinated. We do expect by the end of May that we will be over 4 million people in the Commonwealth vaccinated. Remember, the population of the Commonwealth is just about 7 million people. And we were looking, the goal was to get to 4.1 at least. So now that we're getting to that level, it was good to hear Dr. Potvin mentioned about Beth Israel opening their site at Colony Place to walk-ins. CVS has just announced in the last hour that they are now all walk-ins as well throughout the country, including Massachusetts. So you can walk into a CVS and get a vaccination as well. And the whole goal of this, and I'm going to differ a little bit with Dr. Triffletti, I think the whole goal is to really educate and get vaccines to the people where they are. We live in a society now where people are looking for convenience, and wherever we can get them convenience. So everyone goes to CVS or Walgreens. So you go to CVS to get something, you might as well stop in and get your vaccination while you're there. They're looking for that convenience. We're also going to be, shutting down 4 of the 7 mass vaccination sites at the end of June. That will include Gillette, Hines, the Doubletree, and Native Mall. But what will happen? What's coming up in its place will be there'll be several dozen smaller sites. There'll be physicians that will be getting these vaccinations, plentiful vaccinations. Senior centers, as I was mentioned to Michelle, senior centers will be a place that people can go. YMCAs, churches, Again, it's really trying to get people that are at these places anyways and get the vaccines there. So while they're there, they can get the vaccination. So that's the public service announcements that we're going to be doing. You'll see more, I think, celebrities that will be coming on board, other than myself and Ken, that will be coming on board too. Just kidding. That will be asking people to get vaccinations. The vaccinations are as the physicians have noted, are safe. There's been 200 million that have been given, no issues whatsoever. So I think it's safe to say we just got to get the vaccinations to the people where they are. So that's where we're going to go the next step. Just in terms of the numbers that Michelle did, Plymouth is much better than the Commonwealth. When you talk about the over 75 population, and the Commonwealth it's 77%, which is good, but Plymouth is a lot higher in that population. Those 65 to 74, we're at 76% that are fully vaccinated. 50 to 64-year-olds, 52%. And then it kind of goes down from there, 30 to 49-year-olds, 38%. So that's the age groups that you want to start getting to now and make it convenient for them to do that. I just thought this was kind of interesting too. It seems to be that females are getting vaccinated more, a lot higher than males are, somewhere around 55 to 45%. So I know I just thought that was striking, but I think we need to get again the word out to people to get more people vaccinated. And I think by having them in physicians' offices, and I've been saying this for a long time now, I think makes a lot of sense, because that's where people that maybe on the are thinking about getting it but not sure, they're not sure of the side effects, they're going to listen for the most part to their own physicians. And if the physicians can have their conversation with them and have the vaccine available to them, then they can actually distribute it. So that is the update from the state today, Steve.
Celebrity Plymouth State Representative Matthew Muratore. At this time, we're going to go back to our panel. And as we have their closing statement, I also have a question for each of them. First to Dr. Phil. Dr. Phil, viewer asks, if grandparents are vaccinated, but their grandchildren are under 16, is it safe to get together as a family and a hug? Dr. Phil.
Well, I think when you look at who's the most vulnerable, it's really the older individuals are more vulnerable. It's sort of the same answer that I give to indoor dining once you've been fully vaccinated. And I do think that the risk of infection is quite low, and the risk of a serious infection is even lower. So if you choose to do it with masks, the hug, that's even safer. But I really wouldn't have a big concern if the child is not having any symptoms of feeling ill and both people are wearing masks, a hug, I think, would be fine with a fully vaccinated person.
Thank you. And any closing thoughts, Dr. Phil?
Well, just to reiterate, I want to just keep pounding the message, to get vaccinated. And like Matt said, talking to your primary care physician about any questions or concerns you have. That's one of the best resources that you can go to, to get that kind of information. So I would highly recommend that. I want to say Happy Mother's Day out there to all the mothers coming up this weekend. I hope they have a wonderful weekend. And then lastly, I just want to, Barry had mentioned briefly about the crisis in India. They're having about 400,000 infections per day. And of course, they're a much larger country than us. They're, about 4 times larger than the United States. But you're going to see the hospitalizations and the deaths are going to lag behind the rates of infections. Their infections are climbing very steeply right now. So I think we just all have to pray for India and other parts of the world, who are not as fortunate. India only has 2% of their population vaccinated. We have a much larger percentage. We're very fortunate here. Hopefully, as time goes on, we can do more to help India and other parts of the world. So I wish you all well and stay safe out there.
Thank you, Dr. Philip Triffletti. At this time, we're going to go to Dr. Barry Potvin. And Barry, viewer asks, can you confirm the location in the old Pier 1? Is that a walk-in vaccination site also, or appointments needed? And does someone need to be a Plymouth resident?
Yes, sure, Steve. That is going to be a walk-in site. You don't need appointments to go there. That will start the week of the 10th to the 14th. and it's probably very conveniently located for anyone who wishes to get vaccine. So no appointments, walk in starting next week at Colony Place over in the old Pier 1 site. So hopefully anyone can go. If you look at what was sent to me from BID Plymouth, it's not restricted just to Plymouth residents. It's going to be open to anyone and everyone. I would imagine that people in their local service area, which includes a lot of our surrounding towns, would be showing up at the same location also.
And your closing
In
thoughts?
terms of closing thoughts, again, pounding away on the vaccines with Dr. Phil and everyone else. The vaccines are safe. There was concern with the J&J about that rather unusual cerebral stroke problem. And then it was publicized that although it's like 1 in a million or something like that, there's even a higher risk for people who are just getting COVID. The same sort of medical condition occurs with people who actually get sick with COVID, and they get sick with COVID and have that side effect, which could be quite dangerous at a much higher number than people who just get the vaccine. So in all respects, you're much better off getting the vaccines. It's safer for you. It's safer for everyone around you. And you need to keep at it as much as you possibly can. Finally, I'd like to also mention that thanks an awful lot to Kevin Coughlin over at BID Plymouth, who was very cooperative and helpful, and their entire hospital system for opening up this vaccination possibility. It's a real service to our community, and I'm hoping it's going to pay off. And I'd also like to mention, because it was brought up on a DPH webinar recently, that I believe next week is either National Nurses Week or National Nurses Day. Just keep in mind what all these people have done for you. They have put their lives on the line, and they have gone above and beyond the call of duty and done everything they possibly could to help us. And again, thanks to PAC TV, thanks to all the panelists, thank especially to you, Steve, for running these shows for so many months, going on more than a year now. And again, thanks to all the people of Plymouth for actually standing up and going off and getting the vaccine and doing everything they possibly can to try to help and get this under control so that we can go back to having what's going to be something approaching, I hope, the life we used to have before all this happened. Thank you.
Thank you, Dr. Barry Potvin. He is the Chair, Board of Health at the Town of Plymouth. We now go to the Town of Plymouth Director of Elder Affairs, Michelle Bratti. And Michelle, we also have a question for you, and the question has to do with the anxiety experienced by seniors. And the viewer writes, what are you hearing from your local seniors with respect to anxiety? Some people, even if they're vaccinated, are experiencing anxiety and stepping back into the community. Where can people get support if they're having trouble reintegrating back into the community?
It's a great question, Steve, and it's a very thoughtful question. Despite all this talk of hope, and that's important to keep sight of, there is a lot of residual. It's like waves. It's like waves of this. It's going to take a long time for us to really process exactly what has happened and how each person feels personally. For seniors, we are well aware of how isolated they have been, and the toll that takes on you health-wise. And when I refer to health, honestly, primarily it's mental health and in the form of anxiety and depression and feeling hopeless. So seniors in this community are resilient, and that is what we have learned. But if anxiety or depression or sadness is a thought or a feeling, we have resources. We have met with so many seniors through Zoom, phone calls, anyone that has felt that way who reaches out to Cal, we will find you the supportive services right from the comfort of your home necessary to help you through this. We are almost at the end, but there is some fears, even people walking back through our door. We're very careful to ensure that we keep our eye on our seniors and know that every single one of them, there's not one that's going to be left behind. If you are feeling any kind of way, you pick up that phone and call us. You're not a bother. It is our job. It is what we're here for. And we will make sure you're connected to the right resources to feel better. So final thoughts. Yeah. So we're so grateful to the Mass Council on Aging for our partnership grant with Duxbury COA and are proud to present our second Cooking Together bag of ingredients and recipe. This time brought to you by our very own delicious and nutritious team of Chef Jerry Levine and dietitian Marsha Richards. These are activities, and also in response to the question, these are some things that will help people feel like they're integrating back into the senior society. These awesome chefs will be preparing a Mediterranean chicken and pasta dish, and Cal will be giving you all the ingredients to make this incredible meal at home. You can see them cook this live on their Zoom show May 21st and make the meal at your own pace as the recipe is provided. This recipe was sampled already in studio by PAC TV staff, and word on the street has it that they cannot stop talking about how amazing it tastes. I'm told, quote, the smell of basil, fresh basil, cooking led others at PAC TV to seek out a sample. Cal has 50 ingredient bag to shares. 20 were already spoken for in a day. This will go quickly, so call Cynthia Snow at 508-830-4230 to register and secure your taste of the Mediterranean today. We have one more exciting event in May that we will be sharing with you shortly. And the final event for this grant caps off in June with the Cornhole Tournament Showdown between Plymouth and Duxbury. If you are a senior that loves cornhole, please call me directly to strategize for town pride. I expect to see some of my fellow panelists and their friends and or family and PAC TV crew representing Plymouth. Thanks, Steve.
Thank you, Michelle Bratti. We're going to go to Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. Amy, the question for you, what are the most important common areas our local businesses need support right now? Where are those areas, and your closing thoughts?
Common areas, certainly supporting them financially, sharing their business on Facebook, and the power of social media is fantastic. People are always looking for recommendations, so that's a great way to support them, and certainly by stopping in and dining at the local businesses, as well as, because of the hiring challenge, sharing with folks that are in the job market about the opportunities that our local businesses have available. And closing thoughts, Steve, as you know, and I hope I see you on Saturday at Plymouth Fitness. I know you are a fitness buff and work out quite frequently. We have a great day ahead of us, full of lots of great workouts, all for the Plymouth One Fund. But something else I wanted to share with you, a great way to show your support to small businesses is to wear it, right? So we've created these great t-shirts that support local, love where you live. And we are selling those at all of our events. And we will have those, of course, on Saturday and then at the chamber offices for sale. So we love where we live and support local. Thank you.
Thank you, Amy Naples. And those are multiple great suggestions for how we can help our businesses without even spending any money. The recommendations, the reviews, and the referrals. Terrific suggestions. Matt Muratore, the governor is talking about closing some sites. You mentioned that. Will that have any impact on the options for local sites, and how do you want to close today?
Yeah, so I, as I indicated, they are closing the major sites, but again, trying to get sites locally like the BID, Leahy, and Colony Place, all the CVSs now. That's really the goal, trying to get more of these local, get every physician to have them. So that's going to be the goal at this point moving forward. Because if you go to the CVS site right now, for an example, there's plenty of vaccines available. That's why they're doing walk-ins now. So we don't have the problem with that. If you wanted a vaccine today, you could get one today. So I think I do want to indicate too that tomorrow is National Nurses Day. It's a day that we do celebrate nurses in all, whatever industry they're in. I'm sure the physicians would agree with me that they couldn't do it without the nurses, and none of us could have been where we are today without the nurses in this past year. So be sure to thank a nurse, no matter what capacity, what role they're in, where they work, but please thank a nurse for what they have done and what they continue to do for us. And the last thought I have, Steve, is this will go to my celebrity status if I can make this. This is the saying I just made up. Don't relax until you get the vax.
Oh, Matt.
See you next week, Steve.
See you next week, because next week we've got another great cast to join our celebrities, Ken and you, Dr. Mark Wilson, also Sarah Cloud, and we have two school athletic directors, Justin Domingos and Scott Fry, and for the business segment, Stephen Cole. A great lineup next week. Ken Tavares, you're back with us, and I see that you can see that we've had a very good panel today. Ken. Yeah. And turn on your, there you go. Go ahead, Ken.
There we go. It's always tough to follow the representative, so I'm going to look for the last show that I don't have to do that. We got to change something around here and mix it up a little bit. Matt's a tough act to follow, but I want to thank also everyone that's been on the panel today. The news is uplifting, and I think that's the difference that a year has made. A year ago at this time, we were really in the depth of not knowing what was going to happen and how we were going to deal with the virus. But now we can see our way clear. It certainly is uplifting to hear that we can get vaccinated just by stepping into one of our local drug stores. And I think that the slow openings that we're putting on our government buildings are going to be extremely helpful. We're wakening up, and I think that that speaks volumes for everyone that has been so involved over the last year. It would take hours to thank everyone that has contributed to making sure that people have gotten through this safely. So again, great appreciation for everything that's been done. And again, a big thank you to you, Steve, and to certainly PAC TV for giving us the opportunity to bring accurate information to our residents. Thank you all.
Thank you. Thank you, Ken. And I know you mentioned you're in a fall, although I understand Maggie has said we should see the other guy. So good for you for being here today. And thank you to all of our panelists. We'll be back here next Wednesday at noon. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.